All right, you are dispatched to a 45-year-old female for a change in responsiveness.
Okay. I'm gonna start by putting on my proper PPE precautions, so gloves, mask, that should be it for now because it's just a nature of illness, medical call. I can always put on more stuff later if I need it. As I approach the scene, I'm gonna check my BSI scene safety. Is the scene safe?
Yeah.
Okay, I'm gonna then check my number of patients. You
Okay.
said there was just the one?
Yep.
Okay, and then what's my nature of illness? You said it was a 45-year-old complaining of chest pain?
Change in responsiveness.
Change in responsiveness. Okay, change in responsiveness. Okay, and then I'm gonna call additional ALS because we don't know what is going on right now. I can always cancel them later if I need to, but they're safe and sorry. As it doesn't sound like there was any fall involved, we're gonna hold off on C-spine. We can always have my partner do it later. As I walk up, what's my general impression? You told me in dispatch there was the change in responsiveness. Is there anything I see as I walk up, such as massive hemorrhages? Any bleeding through her clothes?
All right, the patient is slumped over a break room table in a busy office building. Her eyes are open, but she is slow to respond. There is an open can of soda on the table next to her.
Okay. I'm then gonna assess my level of consciousness. So as I walk in, I say, "Hey, I'm Luke. I'm being your EMT today. What seems to be the problem?" Does she respond to that?
She responds to verbal, only responds when spoken to, very slow to respond.
Very slow to respond. Okay. It sounds like currently our chief complaint, like you said, is a change in responsiveness, something to do with potentially neurological. We don't know quite yet what it could be. I'm then gonna move my ABCs to try and narrow it down. So I'm gonna start with my airway. You said she was talking. Is the airway patent? Is she breathing just fine?
Yep.
Okay, I'm gonna move into my breathing. So I'm gonna check my lungs. So I'll check both sides.
Okay.
Lung sounds are
Slightly fast.
slightly fast.
Yep.
Okay, what are my respirations looking like?
Respiratory rate of 24, and the SpO2 is 97 on room air.
Okay, I'll get that via pulse ox on the finger. You said it was 92?
97.
97, okay, perfect. 97% on room air. That's 2. I'm then gonna check my circulatory. So I'm going to check my skin tone. What's your skin looking like?
All right. Skin is pale. It is cool and it is very sweaty.
Okay, so somewhat signs of shock, but the airways far noxious. Good. Okay, and then I'm also gonna check my pulse. So I'm gonna check down here.
Okay. Strong, regular, slightly fast.
Starting to slightly fast. Okay, and then going to determine this. It seems like for now she's not a high priority patient, so we're not gonna have her. She's gonna be a stay and play. We can always change that later if we need to. I'm then gonna move into my history taking. So I'm gonna start by getting a baseline set of vitals. I already have my respiratory and my SpO2. Can I get my blood pressure and my beats per minute?
110 beats per minute. Blood pressure is 118 over 76.
118 over 76. Can I also have my blood sugar?
Yep. 40.
40. Okay, that clears up a little bit. Blood sugar, originally at 40. Okay, I'm gonna then move into, just to narrow it down a little more just to make sure, we are going to move into my history taking, like I said. So I'm gonna start with my OPQRST, which is onset, provocation, quality time, radiation, severity. We're gonna start with onset. So what were things leading up to this? Any specific events that happened?
Okay, so a coworker on scene reports she suddenly became confused 15 minutes ago when we were talking. She wasn't making sense and her speech was funny.
Speech was a little funny. Okay. Does anything make this better? Like, did sitting down bring down this confusion or anything like that?
Nope.
Okay. And what's it kind of feel like? You said it was just like a change in mental status, or
Just confused.
yeah, just confused. Okay. And then that sounds good. That sounds good. You said it's going on for about 15 minutes.
Yep.
Okay, perfect. Then I'm going to move into my sample history. So we already kind of got our signs and symptoms. And then we're going to go into asking any allergies. Since they're awake, I'm going to ask them, do you have any allergies to anything?
No known drug allergies.
Okay, you on any medications right now?
Lantus, which is long-acting insulin at night. Humulin, which is short-acting insulin at meals.
Okay.
Lisinopril and amlodipine.
Okay, so mostly for insulin. That makes sense. Okay. Was there any past medical history you need to know? Anything that's pertinent?
Type 1 diabetes and hypertension.
Okay, there we go. What was your last oral intake? So what was the last time you had some food?
Black coffee 3 hours ago.
Okay, so a long time ago. And then were there any other events leading up to this? Were you stressed or anything like that?
She told her coworker that she missed breakfast this morning, running late, getting her daughter to school, and
Okay.
joining an early meeting.
So we haven't eaten much in a while. So then we move into more in depth to figure out what's going on. We already kind of narrowed down. We think we know what's going on. I'm gonna have my partner administer some oral glucose buccally, about 15 grams, and hopefully bring up their blood sugar and get a secondary set of vitals. What's their secondary set of vitals now that they have that oral glucose?
It improves to 70. Mental
70.
status also improves.
Says also improves to 70. Okay, so it sounds like it was just caused by not eating much food and the blood sugar dropping pretty fast, and not something's mostly up. So now we'd transport if need be. If not, we'll give. If we're gonna transport in this case, just to make sure we're all clear. So once we get to the hospital, we're gonna give them a quick rundown of what's going on. The patient was a 45-year-old female who was complaining of a change in responsiveness. It had been going on for about 15 minutes. Their baseline set of vitals was respiratory rate of 24, SpO2 was 97. We were there, totally fine. BPM was 110, and then their blood pressure was 118 over 76. And then where the real problem came is their blood sugar was at 40. We then went through the rest of our history, taking out like that, and then gave them some oral glucose buccally, about 15 grams. That brought them up to 70 for their blood sugar, and they've evened out from there.
Okay, cool.